Right now on CBS in Boston, we want to welcome Dr. Paul Sachs, Clinical Director of the Division of Infectious Diseases at Brigham and Women's Hospital in Boston. Dr. Sachs, thank you so much for your time. And
thank you.
Let's start today with your thoughts on the new CDC mask guidance. Is this necessary?
Well, I think they make a lot of sense, and they make a lot of sense because what we've observed now, and we know this here in Massachusetts, is that the Delta variant has become the dominant variant in the United States and in our state, and it's much more transmissible. And so we need to do everything we can to prevent infection, especially among those who are unvaccinated. We're also seeing breakthrough cases. The breakthrough cases are mostly pretty mild, but some are more severe, especially in people whose immune systems are weakened. So I think making an advice for masking in public spaces indoors makes sense.
Now that we've been through this very long, almost year and a half, there are so many people in Massachusetts who are vaccinated. We do acknowledge there will be some people who will roll their eyes at this and view it as a step backward and say, I'm not going back. What's your message to them?
I think that it's good to think about your community, about your family, your friends, as well as yourself. It's true that the vaccines are very effective, and they're effective in both preventing you from getting sick, and they also reduce the risk that you'll pass the virus on to someone else. But having now talked to several people who've had breakthrough cases, it's not always such a mild illness. It is very inconvenient at the very least. Sometimes in people whose immune systems are weakened, it can still be quite severe because they can't respond to the vaccines. And it's really a reminder that the virus doesn't care that we're tired of it. It's basically circulating around, and this variant is very contagious. And so we just need to be careful a bit longer. Notice we're not recommending that masks be worn outdoors. I think we've made some progress there. And because it's the summertime, we can really take advantage of that.
What do you anticipate the new school year will look like for students and teachers?
Well, I hope that those who are eligible are able to get vaccinated. So remember, a lot of the school kids can get vaccinated if they're above age 12. And then also I'm hoping that the teachers and the other people who work in schools are vaccinated, because that's the best way that they can be protected. For the younger age school kids, mask wearing indoors makes sense. It's a way of reducing the spread of the virus to others. It's something that we've been doing now for over a year. And, I have to say, again, citing my wife, pediatricians, her anecdotal impressions is that kids are actually quite good at wearing masks. So I think that is something that we should at least anticipate until we have a good sense of where this Delta variant is going.
Dr. Paul Sachs from Brigham and Women's Hospital in Boston, we appreciate you. Thanks.